there, everybody. I'm so sorry that this video is a bit slanted. That is the problem you get if you don't have a tripod stand and you still want to make a video. So that's by the way. Today I'll be teaching us something very important in anatomy. The anastomosis of the elbow joint. You might be asking yourself what is anastomosis, but it's very easy. Coming together, anastomosing, combining. So anastomosis simply means it is a process where two arteries, two veins, three nerves, or what have you, come together and combine to create another pathway. So a branch from an artery, this is an artery, let's say this is an artery, and this is another artery coming from here. So we want to create another pathway. We know that this artery is supposed to go here, then maybe go to this side, but then we want to create another pathway. So what will happen? This artery will give a branch, and this artery will give another branch, and they will combine. This is what is called anastomosis. Okay, so this blood is flowing from here with the heart, let's presume, flowing from here and can go through here. But it can also go through this anastomotic channel and reach here. It can also flow through here and reach here. So assuming there is a blockage somewhere around here, and the blood coming from the heart can no longer reach this part. So this is blocked or cut off. So instead of, oh my god, it can just easily flow here. And then it joins and supplies whatever organ you have. So that is just the essence of anastomosis. Now, we'll go back to what we have. So this anastomosis around the elbow joint is very, very important. Very, very important. And I'm going to be taking it step by step. We are going to be seeing the anastomosis of the elbow joint step by step, in the sense that we're going to look at it anteriorly, posteriorly, both at the medial epicondyle of the humerus and the lateral epicondyle of the humerus. Okay? We all know that the blood is coming from the heart. Yes. So if the blood is coming from the heart, let's say this is the heart, pumps blood. The anastomosis around the elbow joint, around here, by two main arteries, or will I say three main arteries: the radial artery, ulnar artery, and the brachial artery. Remember, you have your subclavian, your axillary, and then let's assume this is our teres major muscle. So our teres major muscle. If this is our teres major muscle, what happens? It shows the demarcation of the axillary artery from the brachial artery. So this is what we have. So two things you should know is that anastomosis is just joining of arteries, and then an important thing is anastomosis around the elbow joint involves which artery? Three arteries. We have the brachial artery, we have our ulnar artery. Let's assume that this is your lateral epicondyle, and this is your medial epicondyle of the humerus. I explain it, drawing the full diagram, but I want you to understand this is your teres major because it is a landmark that differentiates the axillary artery from the brachial artery. Now we are going to form this anastomotic cords. First of all, we want to know the medial epicondyle. Very easy. The ulnar side is the bottom side, the medial side. Okay, so that is the ulnar artery, and then the medial epicondyle is also medial. So we want to see, normally the anastomotic channel should be within the brachial artery and the ulnar artery because it's medial. Okay, so let's start with this artery, the superior collateral artery. And this is the inferior collateral artery. The superior collateral artery anastomose with the posterior ulnar recurrent artery. Posterior. And the inferior, remember this is superior because it starts more proximal. It's superior to this artery. Inferior. If you look closely, this is superior, this is inferior. Inferior has shorter legs and will anastomose with the anterior ulnar recurrent. Whenever an artery goes backwards, it's called recurrent artery. Okay, take note. So this is the collateral, means going downwards. Term for it. This is the superior ulnar collateral, going towards ulnar, and then this is the posterior ulnar recurrent. This guy here is the anterior ulnar recurrent, and this is our inferior ulnar collateral. So this is anastomosis around the elbow joint, medial, that's at medial epicondyle. Very, very easy. So we now go to the lateral epicondyle. In the lateral epicondyle, what happens? Okay, we're now going to see some branches. There's a branch, a very, very important branch of the brachial artery. Remember, this is the brachial artery. So this is the profunda brachial artery that goes backwards, travels through the lower interval, and then it goes through the radial groove alongside the radial nerve. So the radial nerve travels alongside the profunda brachial artery. Remember, the profunda brachial artery is a branch of the brachial artery. Profunda meaning it is deep, so it kind of goes back follows through the radial groove of the humerus, which I've not shown here because it is not important. Now we have this profunda breaker artery is going to help us in anastomosis of the elbow joint at the lateral epicondyle. Remember at lateral epicondyle. How I remember this is that I usually think of it as, okay, this is my profunda breaker artery. It is deep. It goes through the radial groove of the humerus, so it is going to help me form anastomosis with the at the elbow joint with the help of the radial artery. Okay, so this is the radial artery. It's going to form what? A radial recurrent artery. This is a radial recurrent artery, and this profunda breaker artery is going to divide into two: anterior and the posterior descending artery. The descending artery is a branch of the profunda breaker artery. So this anterior descending artery, it will anastomose with the radial recurrent artery. Radial recurrent artery. Unfortunately, fortunately, this is the only branch of the radial artery that forms anastomosis around the hip joint. You are going to ask me what's going to give the branch that will anastomose with this middle collateral artery, also known as posterior descending artery, a branch of the profunda breaker artery. Well, don't worry, the ulnar artery will come to our aid. You see that ulnar artery is not only forming anastomosis at each one side. It's like a tusapain. It's going to tusapain someone that cannot stay one place. So it's leaving its medial side and gives off branches that goes to the lateral side to anastomose with this posterior descending artery, which is a branch of the profunda breaker artery. Now, this is the ulnar artery. It gives off a branch. In fact, a trunk. This is a trunk. This is the common interosseous trunk. There is something called the interosseous membrane that lies between the two bones. Interosseous, between bone. Interosseous. So this is interosseous membrane, and this is the ulnar artery, giving off a branch, which is the common interosseous artery. When it passes through here, it forms the anterior branch and the posterior branch. So this is anterior ulnar interosseous artery. You can also say anterior interosseous artery, and this is the posterior interosseous artery. And all of them are branches coming from the common interosseous artery, a branch of the ulnar artery. Now remember, this whole thing got messed up once ulnar artery left its medial side to form an anastomotic channel with the posterior descending artery, which is the branch of the profunda breaker artery. Now you have to be very careful. Okay, so this is the posterior interosseous artery. It's going to give me a branch that will anastomose with the posterior descending artery, which is the interosseous recurrence. Very important. I remember this because I feel like, okay, posterior descending artery is posterior, and for me to anastomose with it, I have to posterior. And since it's coming from the ulnar, I know it's interosseous. So posterior interosseous, not arterial, because I'm anastomized, I'm putting anastomotic channel with the posterior descending artery. So this goes. Okay, let's see, this is. Remember, this is the channel. So it goes backwards, forms anastomotic channel. So this is the posterior descending artery, a branch of the posterior. Remember, I told you it is called the middle collateral artery because it kind of runs in the middle collateral artery. And this is your what? Posterior interosseous artery. And this is your anterior interosseous artery. So we have managed to form anastomotic channels at the elbow using our medial and lateral epicondyle as a landmark. Anteriorly, there is an anastomotic channel in the medial epicondyle. Posteriorly, there is an anastomotic channel in the medial epicondyle, and also in the lateral epicondyle, there is an anastomotic channel in the medial epicondyle, and posteriorly, there is an anastomic channel in the lateral epicondyle. But we're forgetting something. There is also olecranon process of the ulnar bone. So the ulnar bone gives an olecranon process, and there is also an anastomotic channel there. So for me, you don't have to worry about this channel because it's very, very easy to remember. It is coming from the branches of the brachial artery and the profunda breaker artery. How? You see this anterior descending artery and this posterior descending artery and the inferior collateral artery. They are together, 1, 2, 3. So you can learn this diagram, and when it will give me branches that will anastomose at the olecranon process, which is more like a bony projection from the ulnar bone. Here, olecranon process. So we have the anastomotic channel forming here is inferior ulnar collateral artery, a branch of the brachial artery, plus combining with the anterior and posterior descending artery, which are branches of the profunda breaker artery. So with this, I hope we have learned the anastomosis around the elbow joint.